Friends, I want to take a moment to highlight the importance of perseverance in entrepreneurship. Michael's journey shows that facing and overcoming challenges is an integral part of achieving success.
The whole point about a digital twin is, can we take data from the real world and bring it into this virtual environment so that we can run a simulation on it, so that we can determine something?
Michael's work in this area highlights how looking at health from a broader perspective can lead to a better outcomes for entire communities.
Value-based care is about making it so that the payment that a provider receives is attached to how healthy the patient is. And as a patient or as a human being, you should be happy about that. Ultimately, people should be paid by how effective the care is for you.
If you are in the healthcare industry, understanding and leveraging this technology can be a game changer for patient care. Welcome to the Canadian SME Small Business Podcast. I'm your host, SK, and today we are excited to bring you another enriching episode. Our show is dedicated to delivering valuable insights and stories that empower small business owners across Canada. Today, we will explore the intriguing topics of digital twins, value-based healthcare, and population health. Our guest for this episode is Michael Millar, the CEO and founder of Verto Health and an Adjunct Lecturer at the Institute of Health Policy, Management and Evaluation at the University of Toronto. As a computer scientist and a Master of Health Informatics, Michael combines his deep understanding of modern technology with a system-level understanding of the complexities of healthcare management to create innovative solutions for long-standing problems in care coordination. Join us as we delve into Michael's journey and explore how Verto Health is making significant strides in the healthcare industry. Hello, Michael. How are you doing today?
Not bad. It's been a good day. How about you?
It's really amazing to have you on our Canadian SME Small Business Podcast. Michael, your extensive background in digital health and your innovative solutions at Verto Health are something we are eager to discuss today. Every entrepreneur has a unique journey that shapes their vision and goals. Michael, can you share with us your journey in the digital health sector and what inspired you to found Verto Health?
Yeah, that's a great question. So I've always been a technologist since a kid. And when I graduated from university with computer science, there's just so many different things that you can do. And I realized the first job that you take defines where you're going to go. And so I thought about it, and I decided to work either in digital health or education. And I just felt connected to digital health. And so ever since the early 2000s, so that's been my area of focus, even before it was really a predominant area of digital growth. But yeah, like primarily when I really investigated and looked into it, everything in healthcare is about information. And the power of a technology, especially modern computer technology, is accentuated by how much information is a core business problem in that industry. And so I think it's a very exciting industry to go into if you're ready to deal with complex problems around information.
Okay. And what were some of the key challenges you faced in the early stages and how did you overcome them?
That's a great question. So when I started Verto, definitely the big challenges is healthcare is not a traditionally small business focused type of industry. Usually you have to have credentials, you have to know how to work with privacy, security. There's a lot of trust in healthcare. Right. And so the biggest challenge is going from zero to something, and I think in healthcare. And so it was actually the reason I waited until we had a significant opportunity to deploy with a hospital system before I decided to take the plunge in. And so kind of a good lesson is try pushing as many risks away from when you're operating the business and try making them before you decide to just jump into the business. A lesson that worked well for me. Okay.
Michael, what will be your advice to other entrepreneurs who are just starting out?
Specifically in healthcare or?
Yeah, in healthcare you can.
Okay. Yeah. If you're looking to start out in healthcare, I think the number one thing I'm going to say to people is if you're interested about technology and everything, AI, that's great, but you still have to solve a problem. So one of the things that I heard that really resonated with me is that you need to fall in love with the problem in order to create a great business. And so if you find a problem and you know that, and you're like, I want to solve this, and that problem is shared not only by yourself, but with many people, that I think is an important starting point. And then you can mobilize people, or not only people that you employ, but people that you sell to, around the fact that you're solving that problem.
Okay. Thank you, Michael, for sharing your valuable advice with our audience who are trying to enter the healthcare industry. Like, there is some interesting stats that I want to share with you. Like, in Canada this year, the digital health market is projected to reach around $3.5 billion, reflecting the growing importance and acceptance of digital health solutions. How will the market growth impact the adoption of innovative healthcare technologies?
Yeah, it is definitely a growing market, but in an interesting way. There's a lot of incumbents that already take up quite a large portion of that share, and especially in the digital health zone. We're looking at like the Epics, the Cerners, the large electronic medical record systems. But that being said, healthcare is facing an incredible crisis right now. It's called the Health Human Resource Shortage, so they call it HHR. And what that basically means is that they just can't find enough nurses and doctors to be able to meet the demand from the public. I think that that's a wonderful opportunity for digital health. I think that if you are thinking of creating a new solution and entering into the market, you have to think of a way that you are helping the providers deliver care more efficiently. If your solution can offer 40 to like 50, 60% savings, or even automate an entire role, now is a great time to enter into the digital health market. But if your solution conversely requires a nurse or a clinician to operate it, it's going to be very hard to sell into the market right now.
Right. Friends, I want to take a moment to highlight the importance of perseverance in entrepreneurship. Michael's journey shows that facing and overcoming challenges is an integral part of achieving success. If you're facing tough times, remember that persistence and innovation are the key. Moving forward, let's discuss about the digital twins. The concept of digital twins is fascinating and holds great potential in the healthcare industry. Can you explain what a digital twin is and how it can be used in the healthcare?
Yeah. I'm starting to realize that, first of all, digital twins an unbaked concept in the market. So, my background, I played a few computer games here and there, and so for me to think of a virtual environment is very easy. But I think the best way to describe it is like when you're watching a movie, when they do, they're rendering different things. What you're seeing is virtual. It's not real. It's not a real environment, and they've used data to construct that. The whole point about a digital twin is, can we take data from the real world and bring it into this virtual environment so that we can run a simulation on it, so that we can determine something? So a good example is, can I bring all the records about you into this digital environment and then run some algorithms to determine what are your largest risk factors in 3, 5, 10 years? Can I use multiple digital twins from all the people in the health system to understand where a hospital will be overcrowded or overserviced? The whole concept of a digital twin is bringing data from the real world into the virtual world so that you can run forward utilization simulations off of that data, and then use that learning to better plan how you allocate resources in the real world.
Okay. And is AI also being used for using this digital twins?
100%. So one of the interesting things, the digital world, and I teach at University of Toronto in the Health Informatics program, and I always say that I teach my students to think about the real world and the digital world. The digital world has like your account number, your account balance, it has your lab results, and it has data. But data has to be precise. It can't just be generic. But most of the data in healthcare is actually unstructured. It's dirty. It's like a note, it's a summary, maybe a typo. So what we use AI for is to read that data in the real world and convert it into data points that make sense in the virtual world. And so there's a concept called interoperability in healthcare, where the idea is that these systems should already store that data in a structured format so that you can bring it into analytical or virtual worlds easily. But that's not true. And so that's where we've used AI a lot to be able to do that. The second way that we've used AI is to find patterns. So now that we've got all this digital data in this digital twin world, find patterns. How is this group similar? Is it because of the area that they're living in? Is it because of a precondition? And so we've used AI for clustering and pattern recognition inside the virtual world as well, so that we can take that data and now give crazy insights, not off of our belief, but off of the wealth of data that we've seen before, right?
Practical insights, you can say. Right?
Exactly. Like telling you that this is your risk in 10 years, not because I read 4 papers and made an assumption, but because I looked at people who had the similar characteristics as you for the last 20 years, and they had the same outcome. And so I think that it's more real that way, right? One of the things everyone knows in healthcare is that healthcare changes by region. You know, how you deliver healthcare here in Toronto is very different than how you deliver healthcare in Japan or in the Middle East, right? And so you have to understand that localization plays a role, which means you have to read the data locally to understand how to extrapolate going forward.
Thank you, Michael, for sharing your journey and insights into the digital health sector. We are going to take a short break now. When we return, we will discuss how Virto Health is supporting the shift towards value-based healthcare and its impact on patient care.
You dreamt big. You made the leap. You and your "we're not stopping at small" business. Doesn't matter you've never done it before. You unlock those problems. You adapt to change. You learn to evolve. You're pioneers in challenging times, finding your own frontiers. Wherever you e-commerce, UPS is with you. So nothing is going to hold you back.
4 billion people check their email every day. That's 4 billion missed opportunities if your message doesn't make it. To reach your customer's inbox, you need a winning strategy. And Constant Contact delivers. Literally, over 97% deliverability. Elevate your email game with easy-to-use templates, writing assistants powered by AI, and in-depth metrics. Ensuring your email is flawless, delivered, and read. Constant Contact delivers. Give it a try.
At IHG Hotels and Resorts, we're in the business of you.
We're here to help you plug in,
Connect and recharge.
make an impression,
and meet with confidence.
With 19 brands built for business,
your business gets even more rewarding.
With an award-winning loyalty program at 6,000 IHG hotels and resorts worldwide.
Welcome back, everyone. We are here with Michael, founder of Virto Health, discussing the future of healthcare. Now, let's delve into how Virto Health is contributing to the transition towards value-based healthcare. And Michael, how does Virto Health implement digital twins to improve patient outcomes?
Yeah, that's a great question. So, our big passion is about creating technology that actually creates healthier people. And so the way that we implement it is we work with large health systems. So think above a hospital, so maybe a multi-hospital network or a region or authority. We first use AI to tap into their systems and create a digital twin of all the patients that exist within their databases. And the important thing here is your health record does not exist on one system. It actually exists in multiple. So how do we stitch together different pieces of data to create that cohesive medical story about individuals? Once we bring them into the digital twin world, then we can decide on how we want to use that to help. So simple ways would be to identify at-risk populations and reach out to them to enroll them into special healthcare programs so that they can be healthier. But then there's also even simpler ways of just saying, hey, by the way, we can listen to every appointment that exists in the system and send a reminder to you, even if that system doesn't have the ability to remind you. So there's really complex ways that we can use a digital twin to help people, and then there's really simple ways that we can use it to help people as well.
Yeah, and for general, it's not easy to understand.
Yeah,
it's truly incredible to see, how digital twins, as you explained, can really transform healthcare by providing a more personalized and efficient approach. Folks, I want to connect with you on this. The idea of digital twins is groundbreaking. If you are in the healthcare industry, understanding and leveraging this technology can be a game changer for patient care. Imagine being able to predict and address health issues before they become critical. That's the power of digital twins. Now, moving forward, Michael, let's discuss the population health. Population health is a critical area in ensuring the well-being of all the communities. What is population health and why is it important in today's healthcare landscape?
Okay. Wow. Yeah. Population. We don't talk about it enough in Canada. I think one of the things is we're very proud of our universal healthcare system, and I'm proud of it. I think that it is. I want to keep society and civilization healthy, but keeping someone healthy isn't just about medication, about a visit, about surgery. Keeping people healthy is about creating the right supports, right? Population health is a concept that if you just track your, let's say, A1C for diabetes, just a matter of doing the testing means that the medications and the procedures that they give to you to manage diabetes are more, can be simple. They can be cheaper over the span of 10 years. But if you don't do that properly, then the person will have worse things that happen, and maybe worst case, even lower limb amputations that might happen. And so the concept behind population health is how do we look at the holistic care of people around their complex health conditions in a way that makes sense across the hospital, the general practitioner, the community, the home care worker, in a way that's cheaper and better for the person, and it has a higher level of life quality. The interesting thing is Canada was pretty ahead on these integrated and population healthcare models, but recently I'd say we've almost come to the point where we're behind our southern neighbors. Like, one of the things that we look southward is, oh, that's not universal healthcare. So we think that the integrated care model isn't as strong, but they've actually done a really good job about identifying if you have diabetes or if you have COPD, what are the proper types of supports that you need to have the best health or best life possible. They're in a better position to recognize that than we are, and I really want to change that equation for Canada.
So you mean to say, our system requires a proper, a system where we create awareness so that we can prevent a lot of things.
Yeah,
we can put a burden on healthcare system, right?
For sure, it's an incorporation of holistic and preventative care. And the funny thing is, if you can provide more resources and do it for a longer period, and it's actually cheaper than dealing with the consequences of unmanaged care. And that's really the belief of population health.
Yeah, that's a very good point. Thank you so much for sharing with us. How does Virtual Health contribute to advancing the population health initiatives?
Yeah, so by creating a digital twin from all the different records, what we're able to do is track data points that might come up only in one area that other people aren't aware of. And so by bringing all the healthcare data points about you into a central location, now we can know whether or not you qualify or you'd benefit from specific programs. Often in the existing healthcare system, maybe one person or one clinician knows that aspect about you, but unless they execute, unless they find you the right supporting service, unless they communicate to the rest of the care, you might not be receiving the best care. And those are what we call transition and care gaps, or care gaps in general. Those care gaps are what affect people and bring them to unfortunate situations more so than we'd like. And so really the way that our system does it is it kind of, think of it as it creates guardrails around how healthcare is delivered to every patient as they go forward.
Right. I believe your insights just shared into the population health highlight. It really highlights the significance and the impactful work being done at Virtual Health. To everyone tuning in, I want to stress the significance of population health. Michael's work in this area highlights how looking at health from a broader perspective can lead to a better outcomes for entire communities. It's not just about individual care, but about improving healthcare system on a very large scale. Moving forward, let's discuss about value-based healthcare. Value-based healthcare focuses on providing the best outcomes for the patients. How does Virtual Health support the shift towards value-based healthcare?
That's a great question also. So In order to understand how we provide that value, first you have to look at the ecosystem as it is. Most of the tools are not designed to track you as you go through your health story. They're designed to support the provider in delivering a service or a type of care that's specific to them. As a result, for all these population health or value-based kind of ecosystems, let's go back to the concept of value-based care. Value-based care is about making it so that the payment that a provider receives is attached to how healthy the patient is. And as a patient or as a human being, you should be happy about that. Ultimately, people should be paid by how effective the care is for you. Value-based care now makes it so that if you have this disease and you receive the right payment, that's when providers receive the most amount of money. That's a great incentive, but that's harder to do than you think, right? So let's say that you go in for surgery. The only time that you know that all the surgery was done right, the post-care was done correctly, and you're doing better is a year or a year later. So how do you adjust the payment for a person when you only know the data point to do that way in the future? And so value-based care has an extremely difficult time with data. It has an extremely difficult time bringing data from different settings so that you can understand the holistic value of everything that people provided. And so what our platform does is bring that data from different areas so that you can relate the outcome to all the services that were provided to help you get to that outcome. And value-based care needs tools like that so that they can best understand what areas that they need to improve so that the patient gets to the better outcome. But what I really like about that model is the payment is attached to what we want as consumers, which is to be healthy and to have the best health outcome. And so it's really exciting that they have a model like that in the US. Unfortunately, value-based care isn't really the model that we're driving for yet in Canada, but I'm starting to see a lot of changes that make me hopeful.
When do you see it will come into practice?
Well, the exciting thing is we're seeing deployments across in BC and some in Ontario where we're starting to do that. I'd like to see it readily. I'd like it to be the standard in Canada within the next 3-4 years. Okay. It's possible, and in fact, it's necessary. Part of the reason why I talked about the health human resource challenge that healthcare has, that is also a consequence of us using services as opposed to looking at it in terms of holistic care. And so I think all health systems are going to have to become a little bit more smart about how we allocate resources. And so it's a great opportunity for new entrepreneurs to come in if they're solving the real problems.
Right. As you rightly said, the transition to value-based healthcare is very essential. And it's enlightening to hear from you, like how Virto Health is leading this change. Like moving forward, let's discuss the impact of pandemic, which we had back in 2020. The pandemic has drastically impacted the digital health industry. How did the pandemic impact the digital health industry, and what changes do you see continuing in the near future?
That's a great question. The pandemic changed everything. Before, you couldn't get virtual services for everything. And then as soon as the pandemic happened, it was the only way that people could provide service because proximity was bad. The pandemic also created an artificial hype cycle because now everything had to be virtual. So everyone thought that now this was a changing moment where healthcare would go virtual wherever it could. And sitting in 2023 or 2024, we know that they've rescinded almost all the telemedicine codes, both here in Canada as well as the US. Right. And so then the opposite of the hype cycle happened, which is a trough of disillusionment, right? And so now everyone's like, well, maybe virtual care is not going to happen. Well, not really. Now everyone's saying, well, why do we have to meet in person? Like it was more efficient. And so now what you're seeing is that there was a huge decline in the virtual health market. Look at Teladoc, Babylon. There's companies that are struggling. But if you look now it's becoming normalized. People are thinking, well, if we need to be more effective with resources, why don't we cut out travel time? Why don't we do this? And so now the reason why they're doing virtual care isn't because of a pandemic, but it's because of cost drivers and being more efficient. And so there's a little bit of a resurgence happening, But I think what's undeniable is that the pandemic made virtual care part of the tool set, and it's not going anywhere now.
And what key lessons does Vato Health learn from the pandemic?
Well, you learn a lot. You learn that healthcare operates with predictability. So in the pandemic, you remove predictability, healthcare came to a crushing halt as a result. And the other thing that I've learned is that it's more of a general concept, which is you need to know when it's right to pivot a company and when pivoting is bad. Because if you didn't pivot going into the pandemic, then your business model would have fallen apart. But if you don't stop pivoting, then you never can coalesce around a product, and you create confusion in the marketplace. So it was a forced lesson in knowing what are the right conditions to pivot in, and when you have to stop yourself from pivoting and focus on building a company.
It's really the pandemic has indeed brought many challenges and opportunities for each and every industry. And it's crucial to understand its long-term impact, especially on the digital health. Before we wrap up, Michael, what is your key piece of advice for other aspiring entrepreneurs from any industry?
I think that as an entrepreneur, you have to understand you gotta be a little bit crazy. You're doing something crazy. You're the way that
I think not little bit more crazy.
Yeah, it's very crazy. The way that I say it to my company is the world existed before your idea, before your company. So you need to prove to the world why it's a better place because you're bringing your company to existence. And so you need to understand that you have to have that fight inside you. You need to understand that that's what you have to prove. The world works. The world is fine. People are being fed. People wake up. People have lives. And your company doesn't exist. Why does your company have to exist? And if you're not ready to fight to prove why that is true, then maybe your problem isn't strong enough. Maybe you're not ready for it. But you need to understand that that is a fight that you have to be ready for. Because if the answer is that they say, no, we don't need you, that's a lot of years and a lot of sunk costs that you're going to have to deal with on the other side.
Thank you, Michael, for sharing your valuable insights and experiences with our audience today. It was a great pleasure hosting you in our studio.
Yeah, thank you for having me. It was a great conversation.
Thank you. Today, we discuss the innovative concept of digital twins, the importance of population health, and the shift towards value-based healthcare. We would also like to extend our gratitude to our partners, exclusive banking partner RBC, exclusive shipping partner UPS, exclusive email partner Constant Contact, and our exclusive hospitality partner IHG Hotels and Resorts. To stay updated with more insightful episodes, subscribe to the Canadian SME Small Business Magazine by visiting our official website CanadianSME.ca. Until next time, support your local businesses and keep thriving in the world of small business.